Every single morning, millions of people wake up, stumble to their bathroom cabinet, swallow a tiny pill, and believe they are protecting their heart. They are dangerously wrong about the timing. I'm Dr. Mark, and welcome to Dr. Mark Official. With 10 years of experience, I'm here to share trusted advice to help you live healthier every day in simple ways, wherever you are joining us from today. Thank you for being here. Thank you for choosing to invest your time in something that could genuinely change the course of your health, and perhaps even save your life or the life of someone you deeply love. What we are going to talk about today is not complicated. It is not filled with medical jargon that requires a degree to understand. But it is critically important, and it is something that the vast majority of people who take blood pressure medication have never been told by their doctor, their pharmacist, or anyone else who has handed them a prescription and sent them on their way. We live in a world that has become extraordinarily good at identifying problems. High blood pressure, also known as hypertension, has been identified as one of the single most dangerous conditions affecting human beings on this planet. It is called the silent killer for a very good reason. It does not announce itself with dramatic pain. It does not slow you down the way a broken bone would. It creeps quietly through your body, day after day, year after year, doing damage to your arteries, your heart, your kidneys, and your brain, all while you feel perfectly fine. The moment you finally feel it, the moment it makes itself known in an undeniable way, it is often because something has already gone terribly wrong. A heart attack, a stroke, kidney failure. These are the calling cards of uncontrolled high blood pressure, and by the time they arrive, the damage has already been done. So we identified the problem, and that is good. We developed medications that work, and that is also good. Millions of people around the world take these medications every single day, and that represents an enormous step forward in modern medicine. But here is where something went quietly, dangerously wrong. We became so focused on whether people were taking their medication that we largely ignored the question of when they were taking it. And as it turns out, that question of timing is not a minor detail. It is not a footnote. It is one of the most important pieces of the entire puzzle, and ignoring it has been costing people their lives. Let us start by talking about what blood pressure actually does inside your body, because understanding this is the foundation of everything else we are going to discuss. Your blood pressure is not a fixed number. It is not like your height, something that stays relatively constant throughout the day. Your blood pressure moves. It rises and falls in a pattern that is deeply connected to your body's internal clock, a rhythm that scientists call the circadian rhythm. This internal clock governs an enormous number of processes in your body. It controls when you feel sleepy and when you feel alert. It regulates your body temperature. It influences your hormones, your digestion, your immune function, and yes, it has a profound and well-documented effect on your blood pressure. In a healthy individual, blood pressure follows a predictable pattern over the course of 24 hours. During the nighttime hours when you're sleeping, your blood pressure drops. It dips down, sometimes quite significantly, giving your cardiovascular system a period of relative rest. This is entirely normal and entirely healthy. Then, as your body begins to prepare for waking up, something remarkable happens. Even before you open your eyes, even before your alarm goes off, your body begins releasing hormones, particularly adrenaline and cortisol, that begin driving your blood pressure upward. By the time you actually wake up and start moving around, your blood pressure is rising rapidly, and it continues to rise through the early morning hours, typically reaching its peak somewhere between 6 in the morning and noon. This morning surge in blood pressure is not a malfunction. It is your body doing exactly what it evolved to do, preparing you for the demands of an active day. But here is where it becomes dangerous. This same morning surge is the period when heart attacks are most likely to occur. Studies have shown consistently that the risk of having a heart attack is significantly higher in the early morning hours than at any other time of day. The risk of stroke follows a similar pattern. The early morning hours are when the cardiovascular system is under the most stress, and for someone with high blood pressure, that stress is amplified considerably. Now here is the question that should be at the center of every conversation between a patient with hypertension and their healthcare provider. If the most dangerous time of day for your heart and your blood vessels is the early morning, when blood pressure surges to its highest point, should your medication be providing its maximum protective effect during those early morning hours? The answer, when you say it out loud, seems utterly obvious. Of course it should. Your medication should be working hardest exactly when your body needs protection the most. And yet, the conventional advice that most people receive, sometimes explicitly and sometimes simply by implication, is to take their blood pressure medication in the morning. Take it when you wake up. Take it with breakfast. Make it part of your morning routine so you do not forget it. This advice, well-intentioned as it is, may be setting people up for a dangerous gap in protection. Think about how oral medications work. You swallow a pill. Your digestive system absorbs it. It enters your bloodstream. It begins working. This process takes time, typically anywhere from 30 minutes to 2 hours, depending on the medication. But more importantly, for most medications, the peak effect does not come immediately. It builds over time and then it begins to fade. By the time you take your morning pill, get ready for work, have breakfast, and step out the door, your medication may just be beginning to reach therapeutic levels in your bloodstream. Meanwhile, that dangerous morning surge in blood pressure has already happened. The window of greatest cardiovascular risk has already passed or is passing, precisely when your medication is finally getting started. You have taken your protection too late. There is another piece of this that makes the situation even more complicated, and it has to do with what happens at night. When you take your blood pressure medication in the morning, its peak effect typically occurs during the daytime hours, when your blood pressure, while elevated compared to nighttime levels, is not at its most dangerous. Then, as the evening arrives and your body begins preparing for sleep, the medication may be wearing off. Your blood pressure begins its natural nighttime dip. But here is the issue for some people. If your medication is still active during the early nighttime hours, it may be driving your blood pressure too low while you sleep. In medical terms, this is called excessive nocturnal hypotension, and it carries its own serious risks, including dizziness upon waking, falls, and ironically, increased risk of stroke in certain vulnerable populations. So you can end up in a situation where your medication is providing too much effect when your body does not need it, and too little effect when the danger is at its greatest. Research into this area of cardiovascular medicine has been building for decades, but one of the most significant bodies of evidence came from a landmark study that followed thousands of patients with high blood pressure over many years. The researchers divided participants into two groups. One group took all of their blood pressure medication in the morning, as is traditional. The other group took at least one of their blood pressure medications at bedtime, at night, before going to sleep. Both groups were taking the same medications. The only thing that changed was the timing. The results were striking. The group that took their medication at bedtime showed significantly better blood pressure control during the dangerous early morning hours. But more importantly, they experienced dramatically fewer serious cardiovascular events, fewer heart attacks, fewer strokes, fewer cardiovascular deaths. The difference was not marginal. It was the kind of difference that, in the world of medical research, commands serious attention. Now it is important to be honest about the complexity here, because medicine is never simple, and blanket statements can be as dangerous as ignorance. Not every blood pressure medication is the same. There are many different classes of these drugs, including ACE inhibitors, ARBs, calcium channel blockers, beta blockers, diuretics, and others. Each class works through a different mechanism. Each has a different duration of action. Some medications are designed to work for 24 hours, which theoretically should provide steady protection regardless of when they are taken. Others have shorter durations and are much more sensitive to timing. The type of medication you are taking absolutely matters when it comes to the question of timing. There is also the question of individual variation. Human beings are not identical. Some people have what is called a non-dipping blood pressure pattern, meaning their blood pressure does not drop the way it should during sleep. For these individuals, nocturnal hypertension, high blood pressure during the night, is a significant concern, and taking medication at bedtime may be particularly important. Other people are extreme dippers, meaning their blood pressure falls very sharply during sleep, and for them, adding a bedtime dose could potentially cause it to drop dangerously low. This is why the recommendation is never to simply switch your medication timing on your own without guidance, but it is also why this conversation needs to happen with your healthcare provider explicitly and specifically. Let us talk about something that does not get discussed nearly enough, which is the concept of nighttime blood pressure as a predictor of cardiovascular risk. For many years, the standard way of monitoring blood pressure was a reading taken in the office during a daytime appointment. You sit in the chair, the cuff goes on your arm, the numbers are recorded, and a treatment decision is made based on those numbers. But researchers have come to understand that daytime office blood pressure readings, while useful, are only part of the picture. Nighttime blood pressure, the blood pressure you have while you are sleeping, turns out to be a surprisingly powerful predictor of cardiovascular events, in many studies an even more powerful predictor than daytime readings. People who have high nighttime blood pressure, even if their daytime readings look acceptable, are at elevated risk for heart attack and stroke. The way to properly assess nighttime blood pressure is through a test called ambulatory blood pressure monitoring, which involves wearing a monitor that takes automatic readings throughout the day and night over a 24-hour period. This gives a far more complete picture of what your cardiovascular system is actually experiencing around the clock. If your doctor has never recommended this test, and if you have hypertension that has been difficult to control, or if you have other cardiovascular risk factors, it might be a very worthwhile conversation to have. We also need to talk about something that is a quiet epidemic within the epidemic of hypertension, which is the difference between controlled and uncontrolled blood pressure during sleep. A very significant portion of people who appear to have well-controlled blood pressure based on their daytime readings actually have elevated blood pressure during the night, a condition sometimes called masked nocturnal hypertension. They and their doctors believe the situation is under control. The medication numbers look fine, but at night, while they are sleeping and completely unaware, their blood pressure is elevated and the damage is continuing. It is a hidden danger, and it is made more likely when blood pressure medications are taken in the morning and begin to wear off by the time nighttime arrives. Now let us address something practical, because all of this information is only useful if it translates into action. One concern that healthcare providers have about recommending bedtime dosing is the potential for blood pressure to drop too low overnight, particularly when patients stand up in the morning, a condition called orthostatic hypotension. This can cause dizziness, lightheadedness, and falls, which are particularly dangerous for older adults. This is a legitimate concern, and it is one reason why a blanket recommendation to switch all blood pressure medications to bedtime dosing is not appropriate. The decision needs to be individualized. It needs to be made in conversation with someone who knows your specific medications, your specific blood pressure pattern, your other health conditions, and your overall risk profile. But here is what is important to understand. The conversation needs to happen. The question of timing needs to be on the table. If you have been taking your blood pressure medication every morning for years, and nobody has ever discussed with you whether a different timing might be more protective, it is worth bringing up. It is worth asking specifically about whether your particular medications might be more effective, or whether you might be better protected with a different schedule. This is not about doubting your healthcare provider. It is about being an active participant in your own health, which is something that every person deserves to be. There is also an important lifestyle dimension to all of this that is inseparable from the medication conversation. Your blood pressure is influenced by an enormous range of factors beyond just what pills you take and when you take them. Sleep itself is one of the most powerful regulators of blood pressure in the human body. When you sleep poorly, whether because of insomnia, stress, pain, or a condition like sleep apnea, your blood pressure responds. People with untreated sleep apnea, a condition in which breathing repeatedly stops during sleep, have dramatically elevated cardiovascular risk, and one of the primary mechanisms is the effect of sleep apnea on blood pressure. The blood pressure can spike dozens or even hundreds of times per night during apnea events, creating a pattern of dangerous nocturnal hypertension that no medication schedule can fully compensate for if the underlying condition is not addressed. Stress is another powerful driver of blood pressure, and it works in part through those same hormonal systems we discussed earlier, particularly cortisol and adrenaline. Chronic stress keeps these hormone levels elevated, which keeps blood pressure elevated and disrupts the normal daily rhythm of blood pressure variation. Exercise, on the other hand, is one of the most powerful tools we have for improving blood pressure, both immediately and over time. Regular physical activity helps train the cardiovascular system to be more efficient, reduces resting blood pressure, improves the body's sensitivity to blood pressure medications, and supports healthier sleep, which in turn supports healthier blood pressure rhythms. Diet is equally important. The relationship between sodium intake and blood pressure is well established, and reducing sodium can have a meaningful impact on blood pressure levels. But the dietary picture is more complex than just cutting salt. The DASH diet, which emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while minimizing saturated fat, red meat, and added sugars, has been shown in clinical trials to reduce blood pressure significantly. Potassium, magnesium, and calcium, all of which are abundant in a diet rich in whole plant foods, play important roles in blood pressure regulation. And alcohol, which many people do not realize, can significantly raise blood pressure, particularly when consumed in more than moderate amounts. The point here is not to overwhelm you with a list of things to do, but rather to make clear that your blood pressure medication does not exist in isolation. It is one tool in a broader picture of cardiovascular health management, and all of the other factors in that picture interact with each other and with your medication in ways that matter enormously. The timing of your medication matters, but so does the quality of your sleep, so does your stress level, so does what you eat, so does whether you exercise. These are not separate conversations. They are all part of the same conversation about protecting the most vital organ in your body, the heart that has been beating for you since before you were born, the heart that works every moment of every day without rest, the heart that deserves your very best effort at protection. Let us return for a moment to the concept of the morning blood pressure surge, because there is something deeply human about this that deserves acknowledgement. We live in a world of relentless morning demands: alarms, schedules, children to get ready, traffic to navigate, work to get to. The early morning hours are often the most rushed and stressful part of the day, and it is precisely during these hours, when stress hormones are already naturally elevated from the body's own waking process, that the addition of environmental and psychological stress creates a perfect storm. Blood pressure that is already rising due to the normal morning surge gets pushed even higher by the stress of the morning routine. For someone with hypertension, this combination represents a genuine moment of cardiovascular danger that is repeated every single morning of their lives. This is one reason why the practices that help you create a calmer, more gradual morning can have real cardiovascular benefits beyond what they feel like. Waking a little earlier to avoid the frantic rush, taking 5 minutes for slow, deep breathing before getting out of bed, avoiding the immediate shock of alarming news or stressful phone notifications first thing in the morning, drinking a glass of water, moving gently for a few minutes before launching into the demands of the day. These are not trivial lifestyle suggestions. They are practices that genuinely interact with the cardiovascular system during its most vulnerable daily period. And then there is the question of monitoring, which is both simpler and more important than many people realize. Home blood pressure monitoring has become accessible and affordable, and the information it provides is genuinely valuable. Taking your blood pressure at home at different times of day, including when you first wake up before taking any medication, gives you and your healthcare provider real information about what your blood pressure is actually doing throughout the day. It can reveal whether your medication is wearing off before your next dose. It can show whether your morning readings are significantly higher than your afternoon readings, which would be an important signal about your risk profile and your medication timing. It can demonstrate whether lifestyle changes are having a measurable effect. Knowledge is protection, and monitoring gives you knowledge. There is one more thing worth addressing directly, which is the psychological dimension of all of this. Many people who are diagnosed with high blood pressure have complicated feelings about it. Some feel frightened and become overly anxious, checking their blood pressure constantly and creating a cycle of anxiety that actually raises the readings. Others respond in the opposite direction, with denial or minimization, taking the medication inconsistently or abandoning it altogether because they feel fine. Both of these responses are entirely understandable, and both of them are worth addressing openly. Your blood pressure is a number. It is information. It is not a life sentence, and it is not something to be feared or avoided. It is something to be understood and managed intelligently, with the full toolkit of knowledge, medication, lifestyle, and monitoring that modern medicine makes available to you. What we have covered today is not a reason for alarm. It is a reason for awareness. Millions of people take blood pressure medication every day and live long, healthy, full lives because of it. The medication works, but like any tool, it works best when it is used correctly. Understanding that the timing of your medication is not irrelevant, that the morning surge is the most dangerous period of the cardiovascular day, that bedtime dosing may offer important protective advantages for some people and some medications, and that this conversation deserves to happen explicitly with your healthcare provider. All of this puts you in a fundamentally stronger position than most people who are managing high blood pressure. You deserve to be in that stronger position. You deserve to have not just the prescription, but the full understanding of how to use it most effectively. You deserve to know not just that you should take your medication, but when and why and what difference it makes. And the people you love, the people who depend on you, the people who would be devastated by a preventable heart attack or stroke, they deserve the version of you that has this knowledge and acts on it. So take this with you, have the conversation, ask your doctor specifically about the timing of your blood pressure medication and whether your particular medication and your particular blood pressure pattern might mean that bedtime dosing would offer you better protection. Ask about ambulatory blood pressure monitoring if you have never had it done. Monitor your own blood pressure at home and bring those records to your appointments. Support your medication with the lifestyle practices that actually make a measurable difference. And remember that the most important thing you can do with information is not simply possess it, but use it, share it, and let it change the way you take care of yourself. Your heart has been working for you without a single day off since the very beginning of your life. The least you can do is work just as hard for it. Starting today, starting with this knowledge, and starting with the simple but potentially life-saving question of not just whether you take your blood pressure medication, but when. Understanding the most dangerous time to take your blood pressure medication can save your life. Stay informed, ask questions, and protect heart wisely. Dr. Mark encourages you to act today.